joining me this morning. The video of this program is streaming out live to the KSJE Facebook page and also to our YouTube channel. So welcome aboard, everyone. I am so glad that you are with me because this morning we are talking and learning about the Nurse Residency Program here at San Juan Regional Medical Center in Farmington. And joining me here in Studio A is the program coordinator of that residency program. Maranda Marquez is here. And good morning. Thank you for coming in this morning.
Absolutely. Thank you for having me.
Nice to have you here.
Thank
and
you.
Talk to me a little bit about what a residency program is.
Okay, so our nurse residency program, whenever you graduate nursing school, we do get a lot of people from our local colleges here at San Juan College, Pueblo College, as well as we are starting to get a lot of people nationally that have heard about our residency program because it's accredited nationally through the ANCC. So that's a great thing. We take new grads from a nursing program and we transition them into practice. What does exactly that mean? You know, it's hard coming out of nursing school and going into the reality of nursing. So we want to set them up for success, not only to have successful careers, keep them in our community, as well as make them great nurses to give exceptional care for our patients.
Got you. And so does every nursing student, I guess, need to take part in some type of a residency program before they are hired as a full-time nurse, I guess, in a facility, or how does that work?
It does. At San Juan Regional, if you are a new nursing graduate, you have to go through our nurse residency program. And our nurse residency program entails a year of seminars. We also do an evidence-based project. We try to make it really encompassing. We really want they go to their specific units, whether you choose ER, ICU, childbirth. They do go to specific units that are very specialized, but we really like to make well-rounded nurses. So what that means during our seminars, we expose them to a bunch of things. How to communicate, how to manage your stress, how to do self-care. All those things that as humans we really like to do, but starting a new job as a nurse, we really want to help them. We really try to make it fun as well. We do escape rooms, we do simulations, we do relay races, all educational based. And we incorporate kind of a theme. We like to sort them into houses like Harry Potter,
right,
just to make it a better camaraderie where they compete against each other. And at the end, we have a graduation at the end of the year where we really celebrate them and all their achievements and what they've been through in their first year of nursing.
Got you. Very good. And it sounds to me a little bit kind of like on-the-job training a little bit and giving them some real-life examples maybe and experiences of what they'll face as a nurse, right?
Exactly.
In a medical facility, whether it's San Juan Regional or someplace else, I suppose, right?
Absolutely. We do all these kind of simulations, and a really cool thing we do is we take them through different departments. We do this thing called if you experience a heart attack at the hospital, we would take them through the emergency room, take them to the cath lab procedure, and then end on the cardiology unit. So they get that full spectrum of care to kind of see what that goes through. Even if they don't work in any of those departments, they have an idea of the amazing things we kind of do at San Juan Regional.
Right, got you. And I want to go back to what you said earlier, which is the accreditation part of the nurse residency program. That is something that not every residency program has. I know you're very proud of it.
I am, yes.
Talk to me a little bit about what that means. I guess it's another kind of mark on someone's resume, I guess, that they completed a accredited residency program?
Absolutely. So we are really proud of that. We got accredited late last year. It was a process we went through where we had to present our residency program, and it's really showing how we transition new nurses to practice. It's through the American Nurses Credentialing Center, and it was a long process, but it really shows how exceptional our nurse residency program is, that it is something that really gets nurses to that next level. Also, it shows support for new nurses, mentorship for those nurses, all those things that really, we want a new nurse to feel. We want them to feel happy in their job. And like I said, eventually, that translates into excellent patient care that we're giving our patients in our community, right?
Right.
So we are our local hospital, and we're really proud of how we serve our community. So taking those nurses in our community and making them homegrown is really important to us as well.
Sure. And that accreditation, I guess, also means that your program had to meet certain standards and certain requirements, I guess, to get that
Absolutely.
accreditation.
It was a very rigorous process that we had to submit a ton of things and really meet all these kind of standards and guidelines that it's something we're super proud of, yes.
Right. Congratulations.
Oh, thank you.
And I want to talk a little bit, too, about the graduates of our nursing program program here at San Juan Regional Medical Center, because that provides, I would hope, a steady stream of applicants and potential future nurses, right, for your program, and so they kind of funnel into the residency program?
Right, absolutely. So San Juan College definitely gives us a great kind of fill-in from our community, and we're super proud that people are from this community and take care of our community. So yeah, that's been a great thing for us.
Right. And for the career of nursing, you and I were talking about that before we came on the air this morning, a bit about the demand for nursing is still really high, I think, everywhere, right?
Absolutely.
Not necessarily here in the Southwest, but all over the country.
It is, absolutely. So, you know, this is a way that we can not only bring our community nurses in, but also we're starting to get nurses from nationwide.
Right.
We've gotten nurses as far as Wisconsin. We got them from Idaho. We've got it from Montana, just because nurses want to feel supported. They want to feel like they're going somewhere that they, you know, can really grow as a nurse and really transition into a great nurse. And we're super proud of that as well. I was telling you before, it's really rewarding to see these new grads that are kind of green come into nursing and really thrive, and they're going into charge nurse positions, and they're teaching other nurses, and they're getting super involved in our unit council or our partners in care. They're really active in our community. So it's a great thing to see these new nurses transition. It's amazing.
Right. And at the end of the residency program, is it the hope that maybe they'll want to stay and maybe apply for a position at San Juan Regional Medical Center? Is that kind of how it works, or
No,
do some
so
of them transfer out?
They have a position.
Oh, I see.
As soon as they get hired
Thank you.
into the nurse residency program, they have a position on that unit. The nurse residency program is kind of like a cherry on top. It kind of helps them get through, you know, different things like we talked about in a fun, engaging way. Like I said, I'm super active in I'm also the vascular access coordinator, so that it has to do with starting IVs on people. And
Right.
I don't know if you know this, but most people don't like to be poked. So if you can get it the first time, people appreciate that. So
Right.
that is one thing we focus on as well. We want to really be good in different skills, decrease discomfort and patient pain, increase satisfaction of our patients, and getting people to not get poked multiple times is super important to people. So
Right.
we like to call a IV ninja class where they get really good at IVs and stuff like that. So that's just one facet of our program that we're really gearing towards our, you know, patient population to
Sure.
make it a better experience when they come to San Juan Regional. And also, ultimately, it's about the nurse and them having a rewarding career and staying at San Juan Regional and retaining our nurses here in our community. So
Right. Very good. Well, my arm and me, thank you for that. So
you are welcome.
so that's important. And so for these out of town or out of state students that are coming here, or nurses that are coming here, part of the program, then they've got that job. And so is it your hope that they will stick around
Absolutely.
and stay here? Or I guess after a certain amount of time, they're free, I guess, to go somewhere else too.
They are. And it's been proven that nurse residency programs really keep retention, right? So that is a big reason we started our nurse residency program at San Juan Regional, to retain our nurses here in our community. So I think it really shows if you start them, you transition them into a well-rounded nurse. They feel supported by your hospital. They feel supported by, our administration, by everybody. Then they want to stay. They want to stay at our hospital. So, which makes it a great thing.
Right. Very
Because
good.
like you said, we are in a nursing shortage. We want to keep all the nurses we can, and we want to make them happy and make them fulfilled in their job just like everybody else. And having that work-life balance we talk about as well.
Right.
So,
Very good. Well, talk to me a bit about the career of nursing, because it seems like we're in this shortage. We're probably going to be in this shortage for a while, because I'm not getting any younger, and I'm probably going to need a couple nurses to take care of me
everybody will.
shortly, right? And so for a career, I mean, what has it meant to you and maybe to your colleagues too that get into it and stay with it and become very successful at it for maybe a future student who's considering maybe a career in nursing?
Right. So nursing, I could say I've been a nurse 25 years, and I am from this area. I grew up in Bloomfield, New Mexico. So, I mean,
Go Bobcats.
Go Bobcats. I don't know. My kids are PV now, so I got to say,
and
go
Panthers. Okay. There you go.
So, yes. So, I grew up in this community. I escaped for a while. I went to college actually in Alaska, but definitely came back and have been in this community for 25 years as a nurse. And I mean, it is a great thing to be a nurse. It's been an overall very rewarding career. I've done things like pediatric ICU, to our emergency room, to being an educator, to being a coordinator. It's amazing how multifaceted nursing is, how many things you can do. And overall, we really are helping people in a very time of need. I mean, I always say people don't like to go into the emergency room. So if you can be that bright light when you are in the emergency room. So that's what we really like to do. Nursing is an amazing thing. We want to show these new grads how amazing nursing can be and how rewarding it can be in the end. So
Right.
we help do that in the nurse residency program.
Gotcha. Very good. Well, and I would be remiss if I didn't point out, here we are in March, and we are at the 5-year anniversary of the start of the COVID pandemic, when we really saw how much we rely on our healthcare professionals, the nurses, the doctors, and some of those long hours and really high demands that we placed on our medical professionals. And so,
Right.
again, I think, thank you for your service and everyone, your colleagues at the hospital, and all of them who put in those long hours. But it is a rewarding profession, I think, for folks. And you do have to learn, I think, about how not to maybe get overwhelmed and how to deal with the stress. And that is part of what this program teaches young nurses, is it not?
Absolutely, yes. So, I mean, it is a stressful job, and I thank you for thanking me for my service. I always joke my husband's a fireman, and I always say he always gets things for his service. So
You do too.
Thank you.
You're welcome.
Yes, so I mean, it is.
And him too, but you too. You're the one that's here.
It is, exactly. So it's a stressful job, absolutely. We have, we go from areas of very highs to very lows. We go through, the transition into, maybe a comfort care, which is just going through the end of somebody's life. And we want to be that positive person if that happens, So all these things, we try to give them a really good idea of how to be the best person there, and also take care of themselves. I talked about work-life balance. It's awesome being a nurse. It's great. We have a great career, but also you have to take care of yourself. And if you don't, caring for people is great, but if you don't care for yourself, then it leaves you and that's what I think people get burnout in the nursing profession. We want to really make sure we're the support there as the residency program, that they're finding out ways to deal with this burnout, dealing with their feelings. We have these things during seminar called reflections that it's a safe space. They can talk about their feelings and how they're feeling. And it's kind of great because a lot of new grads feel the same way. So they form this bond that they can talk and process everything together, and they feel they're just alone in the fight. They feel like, oh, people are feeling this too. I want to experience this together, and I feel supported. So.
Right. They're not the only one.
They're not the only one.
Yeah,
Yes.
very
yes,
true.
Absolutely.
And you, with 25 years experience, kind of know what you're talking about too,
Yes.
if you're talking about balancing
Right.
work and your personal life
Right.
too. So
Exactly.
that's
Yes.
an important thing.
It is with everybody's job, right?
Very
So,
true. Well,
yes.
that's right. Exactly right. And I wanted to ask you too a little bit about kind of that bedside manner. You mentioned, that nurses are many times the positive light in a really difficult situation, whether it's a patient or a family member of a patient and things like that. And maybe that's hard to teach. I don't know. But how do you do that with nursing students, to try to teach them, how to be that positive light,
Right.
within that positive bedside manner, I guess, when they're in a situation?
Well, and honestly, we hope that people come into nursing because they have a heart for nursing.
Sure.
They want to care for people.
A passion.
A passion, right? They want to care for people. They want to take it. They feel drawn. It's a people job, definitely not for the introvert, right?
Right.
So we definitely try to train them. I think a lot of it is communication. I mean, some of them, we have a wide variety of nurses that come to us as new grads, not just the 20-year-olds, but the ones that this is their second, third career,
Sure,
right?
right.
So they have a little bit more life experience. So really trying to give them, I think, having experiences. We do a lot of case scenarios or simulation, actually real life playing into that situation. Like, what would you do? How would you respond? How would you communicate? What skill would you do? What would you be looking for if this patient was deteriorating? All these things to try to give them those skills and that critical thinking, so when they are in those situations in real life, that they are able to adapt. And of course, we always say, reach out. If you are in a situation where you feel like it is over your head, there is plenty of other people. We are a team here. I mean, and not just of nurses. We have a team of amazing doctors, providers, respiratory therapists, x-ray technologists. I mean, I could go on and go on about physical therapy and wound care. We have an amazing team with a wealth of knowledge that are there to help, and we're all there for the common goal of really taking care of those patients and families.
Nice.
So, yeah.
Well, and I know there's a lot of work at San Juan Regional Medical Center about, and every department, it seems to me, is kind of touched by some of this training and some of this reminding of keeping the patients first in your mind and things along that line. I mean, even from the people that deliver the mail to the people that go around and clean the floors and so on. So I think that is part of the culture, is it not?
It is.
Or trying to be at the hospital, if not already?
Absolutely. I mean, I know we talk about different, yes, nurses are very at the bedside, but we can't do what we do without supply downstairs, getting our supplies up so we can take care of the patients, housekeeping, helping us out, keeping the rooms clean so we can move another patient in. I mean, it is very much, just like I said, nursing is a team sport, but also, our hospital functions. If one area is not, we can't do our job. So we really do. And the ultimate goal, like you said, is really that patient-centered care, family-centered care of that patient, so yeah.
Very good. And so with the residency program, we'll get back to that for a moment.
Yes.
It is a year-long program?
It is. So we do 3 groups a year. We onboard in, we just started a new group in February. We'll start another group in June and then another group in September. You can apply at any time. You just go to our website and you can go to the new nurse residency or new grad and you apply there.
Okay.
And then
so they're kind of staggered throughout the year.
So you decide what department you want to work in. We have amazing departments. I mentioned some already, but you can go to OR. You can go to medical, surgical, nephrology. We have a cardiology unit. There's multiple faceted what speaks to you where you really want to work. So you apply, and then they ask you where you want to work. They give you, give us a couple choices. You get interviewed. You get hired into that unit. And then you also get hired into the nurse residency program. So the nurse residency program, when they first come on, we do a 2-week boot camp. So we kind of bring them into the hospital, do all these skills, these relays, stuff to really get them a good kind of overall view of our hospital.
Sure.
And then they have to attend a monthly seminar for a year, which we kind of already talked about. A lot of things we already do through them.
Right.
And then at the end of the year, they graduate. We have a ceremony where they present their evidence-based project. Our higher-ups come and kind of listen. We celebrate them because it really is a celebration that they've gotten through this year of nursing, all the accomplishments that they made. And then in the second year, we do have 3 seminars or just about professional growth and development. We talk about how to be a charge nurse, how to be a clinical coach, how to get involved with the programs in our hospital, how to, just to go above and beyond, to be that nurse that's exceptional.
Got you. And so with these nurses, how many are in each kind of cohort as you start off? Is there a magic number? Is there a number that you like to have?
A magic number would be like 100, but
all right.
we would love to have as many nurses as we can. And
so it can expand to fill the demand,
Pre-COVID, we had big numbers. And then as COVID went on, our numbers kind of dwindled. And I think now we're finally in recovery from COVID. Our very first cohort 1 was 21. This last cohort that we just onboarded, which was cohort 14, had 19 people in it. So they're getting bigger and bigger, and we're excited. The more nurses we can have in the hospital, the better. Like you said, there's a national shortage. So we really do welcome these new grads and to be at our hospital.
Right.
Yeah.
Very, very true.
Yeah.
And when someone joins, and you mentioned kind of choosing the area of the hospital that they'd like to work in, do you find sometimes that maybe one of those nursing folks will say, "Oh, I don't know if I'm the right fit. Can I switch? Can I check something else out?" Or what happens then?
Yeah. So if they start the orientation process and they feel like that's not the right fit for them, that's what we're there for. We're honestly there to find what's right. And if you're not happy in the area you're at, like I said, nursing is multifaceted. You can go to a way different area and experience a way different thing. So we sit down with them, we talk with them, we go through a process where would you like to work? We have them shadow that area to see if that's a better area for them. But most of the time, that's pretty rare. Honestly, I think our unit managers, our unit educators, all those people do a really great job. Not only am I part of the process as making them feel welcome, but also they are. So they do a really great job in their orientation process. And it's a lot of communication. We really want their orientation, their introduction to the hospital to be successful. So not only do they have a part in that, but also do we. So we do rounding every 2 weeks to check on them. We call their coach is whoever's training them. Check on their coach, make sure they're not having any issues, give them resources, to really set them up for that best successful orientation, so they really do feel like that unit's their home to them.
Got you. And when they get to the end of the residency program, I imagine they've got to be pretty proud of themselves, of their accomplishments, and the higher ups, as you mentioned, at the hospital must be pretty impressed with the work that they've done over those 2-year period, correct?
Right, yeah. It goes into the second year, but at the end of the first year, I spoke about the evidence-based project.
Right.
So kind of what that is they find something in the hospital that they're like, oh, we could do this better, we could do this differently. They go into the evidence-based research and look and see what best practice is. And so when they find out what best practice is, they bring that back and say, we do it this way, but we could do it a little bit better. So they build these projects, and some of those projects have grown into amazing things just from our nurse residents. So not only are they showing these projects, they have made real change at San Juan Regional. We have a thing called a wound vision, thermal imaging, that we can look at people's skin and see if there's any pressure injury when they come into the hospital. And it has been a game changer just to see these areas and really support these patients that already have some type of injury entering the hospital. And one of our residency groups was introduced this thermal scanner, and it's kind of gone on to this big project. So they take it as a great thing that they can really make active change as a new grad nurse in our hospital.
Interesting.
Yeah.
Kind of like a fresh set of eyes, I guess, maybe looking at some things and offering a suggestion, and I guess then the hospital folks maybe investigate and see if that's worth maybe developing, I guess, into an actual program or a regulation or whatever it is, right?
Yeah, and it's a great thing because, medicine's always evolving, always changing. We always have to keep up on the best practice of everything, and it's great to have these fresh eyes come in and be like, hey, we could do this better. And we have everyone, I told you, across the generational spectrum. So different, a 19-year-old might have a different viewpoint than a 50-year-old in their third career, and it brings these great things together.
Yeah.
So,
very interesting. Very good. My guest this morning, Maranda Marquez, is here. She is the program coordinator for the San Juan Regional Medical Center Nurse Residency Program, and we are talking about it. You mentioned you just started your latest cohort in February, so just about a month ago. And so what types of things, they're brand new. So a month into it, what would they be doing these days?
So they're getting used to their unit, right?
Okay.
So they're starting on their units with their coach. I told you we do that 2-week of boot camp. So what we kind of do is just do an overview. We introduce them to all our processes. We introduce them to, kind of our equipment. We want to know how they can use our IV pumps. We want to make them good at, a lot of the nurses come out of nursing school don't get to poke a lot of people. So we talk about good vascular access skills. We go on and we talk about how to take care of a chest tube, all these medical things that, they've experienced, but we give them a better in-depth dive into kind of these skills and also, these situations they might be put in. So that's how we start off the first 2 weeks. And then our first seminar has a lot to do with cardiac stuff. The also really great thing is during our residency program, we try to get them certified in ACLS. It's just a more advanced type if somebody does have a cardiac event. They are more experienced to take care of them, so we try to get them certified in that. So all these things, just a good introduction, and every one of our seminars is based on ANA criteria, which is it's another, that regulates our standards.
Sure.
We try to really we hit all those that we got accredited for. We really have to hit all those things that make it for our accreditation.
And ANA, American Nursing Association, is that what? Okay,
yes.
Just to make sure we
yes.
understand
Sorry.
the acronym. No, that's all right.
I know, it's hard not to, I'm trying to don't throw out medical jargon so people understand.
No, I'm with you.
Yes.
We got you. That's
yes.
good.
Yeah.
But that's important. And I would think, so for these students, it's a little different. Certainly they're getting some hands-on training at school, excuse me, but to do it actually at the hospital and in these real life situations, it's certainly different.
Right.
For lack of a
exactly.
better term.
Yeah. I mean, I always say there's a big transition from nursing school to the reality of nursing. And we really are the bridge for that. We really are the bridge to, do it in a safe space where they can feel comfortable and practice all these things before they're put in a patient situation with it. So we do a whole bunch of things to really, really make, like I said before, to make them well-rounded. You may be an OB nurse delivering babies, but that doesn't mean you don't need to know what happens in the ER, what happens in the OR, different things. So they get exposed to a lot of these different areas, a lot of these different concepts, so they do feel like they know what every part of our hospital does and how they function.
Right, and that sounds very smart to me because we know in an event of a mass casualty, something or what have you, it's kind of an all hands on deck situation, right? And so if you're a OBGYN nurse, you're going to go to the OR or the ER and find out how you can be helpful or whatever the case may be, right? So that cross-training is important.
Yeah, and they also have built this bond with, that's a really great thing because the nurse residency, not everybody's in the same department. So, it's awesome to hear this ER nurse call up to ICU and give report, and they know that nurse, and they have this bond with this nurse because they've gone through a year program with them, and live these, kind of roller coaster of a year, and they feel bonded to them. So that's a kind of awesome thing. We're building bridges between nurses, between different departments as well.
Right, and I think some folks maybe forget how big, even though our hospital is relatively small, maybe the way some hospitals go, but still I think we've got hundreds of employees and multiple floors and things like that. There's a lot of different areas, and so to have that bond and have those connections is important too, to have that well-oiled machine.
Right, and when they first come on, we make them do like a little hunt through the hospital where they have to go find different departments and introduce themselves.
Well, that sounds like me every time I have to go there for something, but okay.
Yes. Yeah, we make them do, like, I felt this way, this is coming into the college doing a hunt this morning.
Well, that's true, we made you do that,
yes.
right.
So we make them do a hunt, find different departments, then they also have to take, a picture with somebody from that department just so they introduce themselves, get to know people. So those are kind of the fun things we do,
Sure.
So to get them throughout the hospital introducing people. So
very, very good. And so you have one cohort that started in February. The next one you mentioned is going to be starting here later on this year.
In June and then September.
Got you. And so for folks who are listening to us this morning who are freshly minted maybe nursing students or will be finishing maybe at the end of May or who knows, this would be a good time, I guess, to maybe start thinking about getting signed up for the next session. Is that right?
Absolutely. Yes, absolutely. So reach out to us at the hospital if you have any questions. I am more than willing to answer any questions anybody has about our program. I get emails. Our director is Blair Chatterton. I'm the coordinator. We get emails all the time. We answer them. We can help you, transition into how you apply, if any burning questions you have, what area you're really interested in working. So reach out to us. We would love to hear from you. You can reach us. Just call the directory at San Juan Regional and you can reach out to us.
There you go.
Yeah.
Very good. And is there a deadline, I guess, to get into that cohort?
There isn't a deadline. Honestly, if you don't get hired the day it starts, then probably you're not going to be in it till the next one. But we have an open application. You can apply anytime. It doesn't close off. We don't have any deadlines. Just go on the website, apply for the new nurse graduate residency program. And if you don't get into the June one, we can put you into the September one, so if it's too late. But it's fully open all the time. Even if you haven't graduated yet, start thinking about it. If you graduate in May, go ahead now, put your application in, and that way you could already have a job set up before you even graduate nursing school. So, that lowers the stress level, I would think, for a recent grad, right, or for future grads. So that's important as well. And we do hire you without, you have to have a graduate license, but you have to be set up to take the NCLEX within 90 days. That is your full nurse certification. So when you first start, you don't even have to be fully licensed as a nurse. We just get you your graduate nurse and you start, and then you can study for your NCLEX and get that taken care of. So
gotcha. Yeah. Very good. Lots of support, it sounds like to me.
Absolutely. And that's what we're all about, honestly, the support and really helping them get through.
Great.
So,
very good. Maranda Marquez, thank you for coming in this morning.
No problem. Thanks for having me. I appreciate it.
You're very welcome, and thanks for the work you and your colleagues do at the hospital. We appreciate that.
Absolutely.
Very
Thank
good.
you.
You're very welcome. My guest this morning right here on KSJE.